Thank you and good morning, everyone. It's nice to see everyone. Thank you for being here. I'm Dr. Sarah Cody, Health Officer for the County of Santa Clara. So first, just a quick update. As of 5 o'clock yesterday, our county had recorded 1,380 confirmed cases of COVID-19 and 46 deaths. While I'd like to say that we won't have any further cases or deaths to report, we know that's not the case. We know the virus is widespread in our community and that we will continue to see more cases, hospitalizations, and deaths in the days, weeks, and months to come. But before I announce today's new order, I do want to share that some signs that our collective action to shelter in place has been protective, has slowed the spread, and has enabled our healthcare facilities to prepare and likely has prevented deaths. However, we must continue to prepare and we must continue to do everything in our power to prevent additional hospitalizations and deaths and to protect our community. So today I'm announcing a new order. This order asks all businesses and individuals to report on a one-time basis inventories of personal protective equipment and ventilators. We're only asking individuals and businesses to report if they have above a minimum amount, and we'll go into more detail about that. So the intent of this order is to ensure that we have comprehensive collective information about what PPE resources exist across our community. We know we need PPE to protect healthcare workers, first responders, and other medical staff so they can continue to deliver critical healthcare services to everyone in our community. Thank you.
So I'm going to take a quick minute to describe a little bit about what the order does, what it's asking for from our community. First, I want to emphasize that this only applies to PPE and ventilators above a minimum quantity, and that's laid out in the order itself. But we're asking all entities and individuals in our community who have inventories above these amounts to fill out a form on the website. It's available in multiple languages. We tried to make it as simple and easy as possible for people to do, so it's not an onerous requirement. But if folks have, for example, more than 5,000 individual gloves or more than 500 medical grade N95 masks or more than 500 non-medical grade N95 masks or more than 500 surgical masks or more than 100 safety goggles or more than 100 face shields, or more than 100 long-sleeve protective gowns of any type, or more than 100 protective coveralls, or more than 500 hair covers, or 500 shoe covers, or more than 100 containers of bleach wipes, or 100 containers of Sani wipes, or more than 100 containers of hand sanitizer. Those are the kinds of quantities where we're asking people to report. If you have less than those quantities, there is no reporting requirement. What we are trying to seek is information on significant inventories of PPE. In addition, we're asking people who may happen to have powered air purifying respirator hoods, controlled air purifying respirators, and related systems in much smaller quantities, and those are relatively rare for people to have, but if people do have those, or if people have any supplies of ventilators, that they also report those. We know that there are actually many businesses in our community that do have some significant stocks of this kind of PPE. Many of them are not being used right now. And getting this awareness will help us know what supply we can source here locally, so that we're not as reliant on scarce state and federal supplies, and so that we can do what we need to as a community. But again, the reporting requirement is only for those amounts in excess of the minimum threshold. So we believe that well over 90% of individuals will have nothing that they need to report, nothing they need to do. But there are many businesses in many sectors who do have significant quantities of PPE, and there may be a handful of individuals who have significant stockpiles of PPE, and we are asking those folks by April 15th to go to the website, fill out the simple survey, and let us know what quantities they have locally. Also wanted to emphasize that this is being asked of folks in the county based on a specific provision in the Health and Safety Code that allows the health officer to obtain information about scarce and critical supplies. And that same provision requires that this information be kept confidential. So it will be only used by the county for public health purposes. This will not be public information. People's proprietary information on what supplies that they have, that will remain confidential. Again, people can provide this by going to our website, which is the public health website, sccphd.org/CV19PPE. And the survey is available in multiple languages. It's not just in English, but also in Spanish, Vietnamese, Chinese. It's available in multiple languages. We've tried to make it as easy to use as possible, so it's a minimum burden on folks, but it's absolutely critical information for us to have. And to explain a little bit more about why it's so critical, I'm now going to turn it over to Dr. Jennifer Tong.
Good morning. My name is Dr. Jennifer Tong. I am leading the Healthcare Surge Capacity Team in the County of Santa Clara Emergency Operations Center. I'd like to further explain the rationale behind this inventory collection. We are preparing for a possible scenario in which we might need more PPE than is currently available for those who are providing care to patients affected by COVID. I'd like to emphasize that currently our hospitals have supplies to continue caring for those patients, and we continue to receive supplies to fulfill requests for support from various healthcare providers. We have made requests to state and federal levels for replenishing of our supplies. But this is a unique situation in which the disaster is so widespread across our state and across our country that we can't rely solely on our state and federal government, and we really have to turn locally to see what capacity for inventory exists here in our county. Our primary goal at this time is awareness. Awareness on our side to know what exists locally, and awareness within the community by people and business entities who might have items of use and who might not even realize that those items could be of use in healthcare settings. We would also encourage conservation of these items and the use of alternatives if feasible so that we can conserve these important personal protective equipment items for those taking care of patients with COVID-19. For those who wish to consider donation of items, we would direct you to the VMC Foundation website. The VMC Foundation is collecting donations for entities across our county, including each hospital in our county when the need arises. I would note that if you offer a donation, there might be some time required to receive a response because we are prioritizing first those items that are in greatest need and those where the quantities are the highest. This is really an opportunity for our community to come together collectively. Most likely all of us will be impacted by knowing someone affected by COVID-19, and so through this collective effort, we can all achieve a better state together. Thank you.
We'll now hear from Supervisor Mike Wasserman, Vice President of the Board of Supervisors.
Thank you and good morning. My name is Mike Wasserman, Santa Clara County District 1 Supervisor. The county is anticipating a shortage of PPE and ventilators. PPE, personal protective equipment, and ventilators. Once again, Dr. Cody and the entire team is trying to stay ahead of the ball, get ahead of things. Their anticipation is that we likely will find a shortage of personal protective equipment and ventilators going forward at the rate we are without other supplies coming in. We are planning for the worst. We are hoping for the best. I want to express my strong support for the actions a public health officer is taking today to protect frontline workers and patients. The order is about protecting the people who protect us. We're sheltered at home. These people are out there on the front lines protecting people who are infected. We need to protect the protectors. We have a shortage of critical PPE that is needed to safeguard our healthcare professionals to allow them to provide quality care. Everyone, government, the public, businesses, large and small, all play a role in addressing this challenge. We need to get clarity on the inventory of the PPE that's out there so we can plan ahead. I want to thank the nurses, the EMTs, the respirator therapists, medical assistants, doctors, and so many other professionals across the county who have been protecting us every day during this crisis. Again, we've been thinking about the victims, and we need to. We've been thinking about the people who will get infected, and we need to. But while all this is going on, those first responders are out there. They have left their families to be out there to protect those most in need. Santa Clara County was one of the first in the nation to have a confirmed case of COVID-19. Our healthcare workers and first responders have been battling this crisis for more than 2 months now. We owe them a debt of gratitude. We owe them the equipment needed to work safely, to protect us. This order is another opportunity for the business community, the public, and the county to come together. We've done a tremendous job of this so far. Please fill out the PPE survey that you heard about and let us know what supplies you have so we can plan ahead. We need to know if we have a lot of something or a shortage of something, and we need to know where those somethings are so that we are prepared when the need comes to address them appropriately. We ask for everyone's continued partnership to keep our community safe. Help us identify the PPE so we can protect those who protect us. Thank you very much.